I am here to let Canadians know that we have granted BC's request for an amendment to their proposal. We have said yes, and it is effective immediately.
What does that mean?
That means that the proposal that was put forward to us by the government of BC to amend the public use consumption under the Section 56, the amendment has been granted.
What lessons will you take from that What lessons will you take from that for other potential applications that go forward on this policy?
So let's be clear, the BC pilot is the only pilot in Canada at this time. We've moved forward with BC on this with a clear lens on public health and public safety, because we know that we need to address the opioid crisis and the overdose deaths that we're seeing as a public health issue. This is a health crisis, not a criminal one. That being said, communities need to be safe. People need to have confidence that in their own communities they can move about freely and feel comfortable and engaged. But we also want to make sure that those who are using drugs also have safety and have healthcare services to support them so that we can save lives.
What's been happening over the past week and a half? Can you tell us more about some of the issues you needed to address before you could say, yes, you can recriminalize public use?
So let's be clear, decriminalization is not the cause of the overdose deaths that we're seeing. It is the illegal toxic drug supply that is killing people. It is a poison supply and it is highly dangerous. Moving forward to any kind of pilot like the one in BC, we know that we have to have a balance, public safety and public health. That means there needs to be sufficient health services in place, scaled out to meet people where they're at, and also law enforcement to have the tools that they need to ensure that public safety is a priority. And then in the case of public consumption, that there shouldn't be disturbances to the public for those who are going about their daily lives. We want to make sure that we look at this from a human-centered lens, that we are compassionate, that we are collaborative, and that we are working with provincial jurisdictions to ensure that health and safety supports are both in place.
So were there not enough supports in place in the example of BC? Like, to my colleague's question, what lessons can be learned from the fact that 1 year into this, you're already having to make tweaks and amendments and recriminalize in public spaces in certain places?
So we went into this with BC when the proposal went into place last year. We always said from the get-go we would be analyzing, we would be monitoring, we would be assessing as we go along, and also be flexible. This is the first time this has been done in Canada. There are a lot of lessons to be learned. What we know is health supports need to be readily available in a timely manner for those who are seeking help when they're using substances. That being said, BC has committed and continues to grow and scale out their health services, and we're supportive of that.
Do you close the door to any further decriminalization?
So decriminalization is one tool of many in a suite of tools that we have in the pillars of our policy approach in addressing the opioid crisis. That means we have to look at prevention, we have to look at harm reduction, we have to support treatment, and we also have to make sure law enforcement has the tools that they need to ensure that those who use drugs aren't recriminalized and are directed to safety and health services, and in extreme circumstances where there is a threat or an issue with public safety for those using drugs that enforcement has the tools that they need.
What is the status of Toronto? There's a lot of uncertainty about what the status of Toronto's application is. So have you looked at this Toronto's application?
Toronto Public Health's application has not come to my desk. The last time it was reviewed by Health Canada was in last year. It's been well over 2 years since the initial proposal was put forward. It was insufficient at the time, and it remains just dormant at this time. It's not on my desk.
What was insufficient about it? Can you clarify what was insufficient?
No, I can't go into the details.
Why not recriminalize, why not recriminalize hard drugs, full stop?
Hard drugs were not, let's be clear, decriminalization did not make cocaine, fentanyl, or methamphetamines legal. The decriminalization pilot was very clear that it was about personal possession of a threshold amount of 2.5 grams for personal use only. This polarization that's been happening and this politicization of the reality that people are dying in our streets from illegal toxic drug supply, to conflate that with whether it's... These drugs are illegal. They have remained illegal. We have not done... Decriminalization is about ensuring that people don't have to face stigma and actually go to get help. And I really am frustrated that the opposition has made this a dehumanizing debate for those who actually need our help, and that they don't recognize we need a full suite of tools to actually save lives.
Can I go back just to my colleague's question about the time in between BC making this request and you making a decision on the request? What sorts of information were you looking at, reviewing? What was going through your mind when deciding, yes or no on what they were asking?
So it's not a matter of what's going through my mind. It's about what we know we need to do to respond to the opioid crisis and to people dying from the illegal toxic drug supply. So in putting the amendment into effect, we want to make sure that police have direction and clear tools of when they encounter someone who is using drugs in a public space, what direction do they have? They should be directing them to healthcare. They should be directing them to supports and services. And that it's in extreme cases where there is public safety concerns that arrests can be made. We want to make sure that people are getting help. That is the focus of this. So when we sit down and look at a proposal, because we are firm on our policy here, we are firm in how we are moving forward to save lives. And to do that, we have to have a careful, well-thought approach. We understood the urgency of this. But we also don't base our decisions on knee-jerk reactions. We base them on that there is clear direction and clear safety and supports for both communities and those who need help through healthcare.
Minister, why can't you clarify the Toronto application issue? We're seeing a large, very
the
heated public debate.
The application is not in front of
Well,
me.
we're asking why
was it
insufficient?
What's the issue?
It's been a dormant application for close to 2 years.
Was this a failure of the pilot, in your view?
No, absolutely not. We said from the get-go that we would adjust and analyze as we move forward. This is the first time this has been done. As in any pilot, it is a process of learning, taking that learning and adjusting and making sure that we move forward so that we're saving lives.
For future applications, because you say it's dormant, Toronto Public Health is still answering questions about it. They still say it's in the hands of Health Canada. So if you want to clear that up. But does the city need provincial approval to move ahead with the decriminalization pilot?
The Prime Minister's been clear about this. I have been clear about this. We work collaboratively with provincial jurisdictions in addressing the toxic drug supply and the overdose crisis.
But does collaboratively mean you need to have provincial approval in order for a city to
Collaboratively means that we work with those jurisdictions that are responsible for delivering healthcare services and law enforcement.
Doug Ford said you would fight the Toronto application like hell. Does Doug Ford's opposition mean that Toronto one won't move forward?
It means that we will continue to work with jurisdictions to explore every tool and every option that we have available to support those who need our help, because this is a health crisis. This is not a criminal issue. Thank you, everyone.
For BC followed with any additional support for British Columbia, for policing or healthcare?
Je voulais parler d'abord de l'assurance médicaments. Là, un projet de loi qui va être, on va enfin avoir un vote après la période des questions là-dessus. C'est extrêmement important. L'assurance médicaments va toucher 6 millions de Canadiens quand il s'agit de diabète. On parle de contraception, on parle de 9 millions de Canadiens. L'impact est majeur à travers le pays et il faut nécessairement procéder. On a Pierre Poilievre qui essaie de bloquer tout ce projet de loi et bloquer tout progrès quand il s'agit de l'assurance médicaments. Nous, on pousse beaucoup justement pour qu'enfin on a ce programme-là mis en place et on peut aider les gens. Il faut dire, quand on parle de diabète, il y a des gens qui payent 1 000 ou 1 500 $ par mois pour ces produits qui sont si importants pour le maintenir en vie. Et là, je connais des concitoyens qui payent ce montant-là. C'est extrêmement important qu'on a en place ce projet de loi. Et je ne comprends pas du tout pourquoi Pierre Poilievre pourrait le bloquer. Aussi, quand on parle de la santé reproductive des femmes, là, la réalité, c'est qu'on parle de 9 millions de personnes touchées. C'est extrêmement important pour la liberté de ces femmes-là de contrôler leur propre santé reproductive, et la contraception est un élément clé. So the reality is we have Pierre Poilievre who is blocking this legislation. We have a key vote coming in just after question period and hoping that this bill will move to the next level. This is extremely important legislation. It will make a difference in the lives of 6 million Canadians who suffer from diabetes. The reality is many of those Canadians are paying up to $1,000 or $1,500 each and every month for the diabetes medication and devices. It is beyond me to even understand a conservative mentality of wanting to block this legislation when it's so important to put into place, and Canadians have been waiting for decades to actually have this legislation in place. So we are calling on Pierre Poilievre to stop blocking, and we're hoping that the vote means that after question period that it proceeds to the next level. And I'll turn things over to Ms. Gazan. With a little adjustment.
Thank you so much. It's such a privilege to join you all today. And unfortunately, I'm not shocked that Pierre Poilievre has indicated that he will not support the pharmacare legislation. He has, in addition to his Conservative caucus, a history of blocking the reproductive rights for individuals in this House. This included a unanimous vote, including by Pierre Poilievre, in support of Bill C-311, a backdoor anti-abortion legislation in the name of so-called violence that was denied and pushed back against by all anti-violence organizations throughout the country, something that was lifted up by the Right to Life Coalition, a well-known anti-abortion group. And now, once again, they are blocking the right to bodily autonomy and the right to choose by trying to stand in the way of individuals getting free contraception. And it sends a very clear message that Poilievre respects freedom for some and not for others. And he certainly doesn't respect the freedom of women to have choice over their own bodily autonomy. Thank you.
Est-ce qu'il y a des questions? Are there any questions?
Yeah, Mr. Julian, what do you think the federal government should be doing when it comes to the ask from British Columbia to recriminalize, drug use and whatnot in public spaces? There's a request that's gone from the province to the feds.
It's not recriminalizing at all. What it is making sure that in certain public places that people can't consume. This is a necessary part of tweaking. This is a pilot project that was put into place. It has carried some results. I mean, the reality is, as we know, even though the death rate is horrifically high in British Columbia, the death rate increase has slowed. We've plateaued. In that sense, it is a first hopeful sign for those who know victims of the toxic drug crisis. What is concerning to us even more is the fast rising death rates now in Alberta and Saskatchewan. And as Gord Johns has pointed out, as our critic, we're seeing now in parts of Alberta and Saskatchewan death rates 3 times higher than British Columbia's. We have been saying all along that this needs to be treated as a national health care crisis. The federal government has been slow to act. We continue to push the Liberals to take action, to declare it a health emergency, and to put the necessary resources in place, for example, for safe consumption, which is something that in British Columbia, the chiefs of police and police departments have been calling out for, more safe consumption sites, so that decriminalization is accompanied by access to safe consumption sites that mean that we save lives. And so the federal government has not handled this as well as it could. It needs to declare a health care emergency, and we need to put additional resources in to save lives, not only in British Columbia, right across the country.
What do you think about the politics that we've seen in this place, and specifically from Pierre Poilievre, about this issue?
I believe it's been profound disinformation. I've known Pierre Poilievre for many years, and I've never seen him distort something as badly and as grossly as the Conservatives have on this. We should be concerned about every death. The fact that in British Columbia, a result of the pilot project, the death rate has plateaued, should be, I think, a source of some comfort that we're starting to find the solutions that we need to find, but the death rate is far too high. Far too many Canadians are dying from toxic overdoses and toxic drugs. And the fast rising rate in Alberta, 17% increase over last year. In Saskatchewan, a 23% increase. this should be disturbing to all members of Parliament from all parties. We should be all saying the federal government needs to act and declare a healthcare emergency. We need to look at every single tool, including safe consumption sites, and the federal government needs to step up to fund those. And for Pierre Poilievre to try to limit it to one province when other provinces are seeing a far more rapid increase. It's projected that Alberta will have a higher death rate than British Columbia by next month. And all parliamentarians should be working together to resolve this crisis and to bring the death rate down. And I'm profoundly disappointed that Pierre Poilievre has been treating this in a partisan way rather than dealing with Canadians who are losing their lives and their families and dealing with it in the kind of adult way that means that ultimately we start to get control of this crisis and bring the death rate down. Merci.
Vous demander une clarification sur l'Alberta par rapport à la compte britannique dans les morts sur les opioïdes. Qu'est-ce que ça prouve à vos yeux?
Mais je trouve le nombre des morts est horrifique à travers le pays. En Colombie-Britannique, au moins, on voit un plateau maintenant au niveau de l'augmentation dans le nombre des morts. Mais c'est très inquiétant. En Alberta, une montée de 17 en Saskatchewan, une montée de 23 Et comme des parlementaires, on devrait être préoccupés par les morts partout où ils se trouvent au Canada et on devrait demander au gouvernement fédéral de mettre en place un état d'urgence de santé pour cette épidémie qui a tué tellement de Canadiennes à travers le pays depuis des années. Il faut qu'on prenne des actions qui correspondent à la difficulté de cette tragédie-là. Puis jusqu'à maintenant, le gouvernement fédéral n'a pas agi. Merci.
M. Drouin?
Oui.
Vos propos d'hier, d'abord, il y a votre collègue du Parti conservateur qui dit que vous devriez vous excuser. Vous en pensez quoi? Répondez quoi?
Bien, écoute, j'ai retiré mes commentaires, je l'admis, mais la francophonie, la défense de la francophonie, de la langue française, ça n'appartient pas au Bloc, ça n'appartient pas au Parti québécois, ça appartient à nous tous. Puis quand j'entends des commentaires qui font aucun sens, bien, je vais le dire.
Comme quoi?
Bien, de là à blâmer l'anglicisation sur McGill puis Dawson, c'est du farfelu.
Il n'y a aucun lien entre l'éducation postsecondaire, la langue.
C'est ça le plus gros problème aujourd'hui? Non. Le plus gros problème aujourd'hui, c'est que nos jeunes sont sur cette plateforme-là. Il n'y a pas de barrière géographique. Les jeunes œuvrent dans un monde anglophone. Donc, parlez-moi de comment on fait pour promouvoir la langue française sur ces plateformes-là. Absolument. Parlez-moi de comment est-ce qu'on fait pour améliorer la découvrabilité francophone sur les plateformes. Absolument. Les problèmes qu'on énonce aujourd'hui ici, c'est la même chose en France sur ces mêmes débats-là, mais ce n'est pas à propos d'une université anglophone qui est en train d'angliciser une province. Là. Pas charrier.
Ce que le témoin disait hier, c'est que c'est pas le seul facteur, mais il dit que ça contribue.
Oui, mais
vous êtes d'accord pour dire que ça contribue?
Le témoin avait une plateforme au niveau d'un comité parlementaire. Pourquoi il n'a pas parlé de le renforcement des institutions francophones au lieu de pointer c'est Dawson, c'est McGill, c'est de leur faute. Parlez-moi de comment on fait pour renforcer les institutions postsecondaires francophones. Absolument, je suis là.
Mais il ne semble pas être le seul à dire ça, puis il dit qu'il y a des données aussi qui soutiennent ça.
Je vous invite à consulter plusieurs chercheurs parce qu'il n'y a pas une unanimité là-dedans.
Juste pour revenir sur ma question initiale, vous avez retiré vos propos, mais le Parti conservateur dit que vous devriez vous excuser. Est-ce que vous allez présenter
Écoute,
des excuses?
Si j'ai insulté les deux témoins qui m'appellent, je vais m'excuser. Absolument. Je ne suis pas une personne méchante, là. Je veux dire, j'ai pas... mais ça m'a pogné sur le coup. Je reconnais que, oui, j'ai utilisé des mots parlementaires quand ça a sorti de ma bouche. Je l'ai dit. Je ne suis pas parfait. Je l'ai retiré tout de suite, je le savais. Mais en même temps, prenez-moi pas pour un con.
Mais vous n'êtes pas certain que vous les avez insultés, là? Vous les avez quoi, honorés en disant qu'ils sont, c'est quoi, de marde?
Ben écoute, je te montre des courriels que je reçois. Je ne suis pas insulté, moi, par ça, mais moi, j'ai une grande carapace. Ça varie, je reconnais que ça varie de personne en personne. Alors, si je les ai insultés, je m'excuse. C'est pas mes intentions d'insulter quelqu'un personnellement, mais les propos qui ont été dits hier, oui, ça faisait pas de sens.
Ça dit quoi, les courriels? Négatif, positif?
Écoute, en février 2023, tout le mouvement indépendantiste me félicitait pour ma sortie pour de la défense de la langue française. Puis là, aujourd'hui, je peux pas répéter. C'est beau.
Merci. Merci beaucoup. C'est quoi des propos de M. Drouin hier?
Bon, en fait, j'ai trouvé ça très décevant. Je pense que c'est inacceptable dans un comité. Et tout le monde a été pris par surprise, même le président, qui n'est pas habitué de gérer ce genre de situation-là. Je pense que plusieurs d'entre vous assistaient au comité et on voit les belles relations qui existent autour de la table. Maintenant, de sortie de nulle part, M. Drouin a prononcé des commentaires assez particuliers et s'adresser directement aux témoins.
Sur le fond de la question, est-ce que le financement des universités, des cégeps anglophones, ça anglicise le Québec?
En fait, ce qu'il faut voir tout simplement, c'est que les témoins sont venus nous donner des données. Il faut se baser sur les données. Si les données ne nous satisfont pas, c'est à nous à faire nos représentations. Mais ce n'est pas à nous à engueuler, permettez-moi l'expression, les témoins qui sont venus très généreusement nous offrir leur savoir.
Mais êtes-vous d'accord avec les données? Est-ce que vous êtes d'accord pour dire que ça anglicise le Québec?
En fait, les données qui ont été déposées, c'est des données que M. j'oublie son nom, Frédéric Lacroix est venu donner. Ils sont véridiques. Alors, à ce moment-là, il faut jongler avec ça puis voir qu'est-ce que ça a comme impact.
M. Drouin ne s'excuse pas. Est-ce qu'il devrait s'excuser?
Oui, il devrait s'excuser.
À qui et comment? Et
s'il
ne s'excuse pas, d'ailleurs, est-ce qu'il devrait quitter le...
Il faudra voir au niveau de la procédure, mais je pense que c'est un homme civilisé. Puis j'espère qu'il va s'excuser, qu'il va accepter l'appel aux excuses.
Mais M. Drouin dit que les témoins le prennent pour un con quand ils font directement un lien entre le financement des anglophones.
Ça, c'est son opinion. Moi, je ne peux pas commenter son opinion, mais comme parlementaire, on se doit de respecter nos témoins, qu'on soit d'accord ou pas d'accord. La pensée unique, je m'excuse, mais c'est pas au comité des langues que ça doit d'exister.
Un autre sujet, le rapport du commissaire aux langues officielles, avez-vous une opinion là-dessus, j'imagine, de votre
Oui, absolument. Le rapport du commissaire est un rapport qui dit, à partir de maintenant, avec la nouvelle loi, on va mettre les outils nécessaires en place pour être encore plus efficace. Maintenant, il y a 2 recommandations. Une qui dit la ministre du Patrimoine doit déposer, en concordance avec le Conseil du Trésor, un plan pour faire en sorte qu'il y ait des indicateurs pour voir si on est dans la bonne direction. C'est lourd comme processus. Puis, ce qui est particulier, c'est que le commissaire s'adresse à la ministre du Patrimoine canadien. Je veux rien que vous informer que la ministre du Patrimoine Canada, qui est une des 2 seules ministres qui apparaît dans la loi des langues officielles, ne veut même pas venir comparaître au comité des langues officielles parce qu'elle a délégué ses pouvoirs. Le commissaire a la même lecture que moi. Il s'adresse à la ministre du Patrimoine canadien. C'est elle qui est dans la loi. Voilà. Merci.
Merci, M. Godin.
Merci.
Alors, bonjour tout le monde. Alexandre Boulris, député de Rosemont-la-Petite-Patrie. Je suis avec mon collègue Peter Julian. Écoutez, on vient de vivre un moment qui est historique à la Chambre des communes avec le vote sur C64, un projet de loi qui met les bases et les fondations sur une assurance médicaments publique universelle, en commençant avec les contraceptifs et aussi les médicaments et les équipements pour les personnes souffrant de diabète. Je suis assez déçu du vote du Bloc québécois cet après-midi. Le Bloc québécois s'est rangé du côté des conservateurs pour tuer dans l'œuf tout projet de loi d'assurance médicaments publique et universelle. C'est extrêmement dommage. C'est demandé par l'Union des consommateurs du Québec, c'est demandé par les grandes centrales syndicales, la FTQ, la CSN, la CSQ. Je trouve ça extrêmement perturbant de voir le Bloc québécois se ranger avec le parti de Pierre Poilievre pour empêcher les personnes au Québec, des femmes, d'avoir accès à des contraceptifs, les patients du diabète d'avoir accès à des médicaments puis à des équipements. Je comprends qu'il doit y avoir un dialogue avec les provinces puis un droit de retrait avec compensation, mais de vouloir tuer dans l'œuf le projet de loi avant même qu'il y ait eu des discussions avec les provinces, ça montre que le Bloc québécois, aujourd'hui, s'est rangé avec les conservateurs. C'est absolument désolant et aberrant. Merci. Je cède la parole à mon ami Peter Julian.
Merci, Alexandre. Peter Julian, NDP House Leader, MP for New Westminster Burnaby. This was a historic moment in the House of Commons. We now have the pharmacare bill moving one step closer to actually being passed, despite the incredible blocking by the Conservatives. Blocking things that will actually benefit their constituents. On average, 17,000 Canadians in each and every riding in the country would benefit from the diabetes medication and devices that are part of the bill. And yet Conservatives have been blocking it for weeks. We also see contraception, women's right to reproductive health, also challenged by the Conservatives. The NDP and Jagmeet Singh overcame that attempt to block this bill. We've moved one step closer, and we're going to continue. The NDP is going to continue to push the entire NDP caucus, our leader, Jagmeet Singh, until pharmacare becomes a reality in Canada, and 6 million Canadians who suffer from diabetes get the kind of help that they need, and 9 million women who need that reproductive freedom also get the help that they need as well. Thank you.